Coming up on today's morning medical update, volunteerism, like most things, took a major hit during the pandemic. We'll share the 3 factors that contributed to the drop in numbers in one specific age group and how a change in our habits has affected patients. Good morning. It is Monday, December 5th. I'm Jessica Lovell. Welcome into the Morning Medical Update. We are live inside the Dulce C. Simons Jr. Family Broadcast Studio. Giving back can be habit forming, but when a massive interruption like a pandemic disrupts routine, those habits can change quickly and have far-reaching effect on others. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. But first, in our morning rounds today, right now there is a national shortage of amoxicillin. It has parents scrambling to find other antibiotics or even a pharmacy that has it in stock. The demand is particularly high because of the so-called triple-demic of COVID, RSV, and the flu. We are joined today by Dr. Sean Sood, a pediatric critical care specialist here at the health system. Dr. Sood, good morning.
Good morning, Jess.
Good to see you. So I ran into this issue. I was telling you, I was traveling over the Thanksgiving holiday in upstate New York, and I was pharmacy hopping trying to find antibiotics for my daughter who had an ear infection. It was kind of like I felt a little out of sorts not being able to have easy access, and I didn't have your phone number in my in my cell phone to give you a call and help me out. But so I know how it feels, and it must feel for parents right now. Their kids are in school, and everyone feels like they're getting sick. So why, first of all, is there a shortage?
Yeah, it's unbelievably frustrating for parents right now, and the reason why we're having a shortage is because there's a huge uptick in pediatric illnesses right now. So many kids are coming to the health system with either the flu or RSV. Anytime you have a viral infection, you can be predisposed to a bacterial infection. So there's more bacterial illnesses in the community right now, and some of these viral illnesses are being mistaken for bacterial illnesses. All of that leads to increased prescription use of amoxicillin.
So is it just amoxicillin, or are there other common medications that you know of that are in short demand?
I had a call and a script for a patient over the weekend, and now there's a shortage of some other alternatives as well. And so we're seeing a trickle-down effect, and it's also hard to find Tylenol, acetaminophen and Motrin at some of our local stores here in the community as well. So pediatric patients are definitely sick right now, and there are shortages of both antibiotics and just common medications as well.
Well, I told you the shelves were wiped out in upstate New York. They had the notes on there. I mean, that's kind of the go-to for parents, just to at least get your kids' fever down. So to know that wasn't, I had to go to like those orange baby aspirins, and my kids were not having it. So it is concerning. How long do we think this shortage is going to last?
Yeah, we've spoken to 2 of the biggest pharmaceutical companies, and they say a few more months.
So amoxicillin, what types of things does that treat? Does that cover a lot?
It does. Amoxicillin does cover a lot. Ear infections, strep throat, pneumonia from the community, or some of the common illnesses that amoxicillin treats, and sinusitis as well.
So what can we do in the meantime? Is there any other medications that you can use in place of it, or is that just the go-to?
Yeah, there are alternatives for all of these conditions. So there's an alternative medication for ear infections, alternative medications for pneumonia and sinusitis and strep throat as well.
Okay, before I let you go, any other, just any advice you can give to parents right now? I know they're concerned, but just it sounds like they need to hold on a little longer and try to keep their kids as safe as possible.
Yeah, parents really shouldn't be worried. There are alternatives to all these conditions that are safe alternatives. And there's also other ways you can use amoxicillin. And so if you have a child that can take applesauce, you can get the alternative version of amoxicillin, sprinkle it on applesauce, and give it to your kid that way as well. It just depends on how old your child is. But parents shouldn't fret. There are safe alternatives, and there's different ways to make sure we can treat these bacterial illnesses.
Real quick though, someone was asking me this the other day, if they have leftover from maybe a previous illness, somebody might be tempted to use that. Is that something they could use, leftover amoxicillin from some time ago?
I'd speak to the pharmacist or take a look, because if it has expired, I wouldn't use it.
Okay, we could ask you a million questions.
Yeah,
so we'll just invite you back. How's that sound?
Yeah, sounds good to me.
Okay, thanks for being with us today, and have a great Monday. Have a great week.
You too.
All right, now to today's topic. The COVID pandemic brought a lot of changes to our lives, as you know, and with it, some uncertainty. Most of us had to change our daily routines, our daily habits, and for a lot of those new routines, they kind of stuck with us. So here at the health system, we noticed a significant drop in older volunteers, but saw an increase in new, younger volunteer populations. So this morning, we want to find out a little bit about why that was. We're pleased to have with us clinical psychologist Dr. Greg Nawalnik and Vanessa Goldsberry. She is the Director of Volunteer and Guest Services, both here at the health system. How are you both doing?
Doing well.
Great. Good to see you on this Monday. We also have two of our volunteers joining us virtually, Jennifer McCormick and Brian Osborne. Jennifer, Brian, how you doing?
Well, thank you.
Well, we're going to get to you in a moment, but just an initial thank you for all you do here in volunteering your time, and we're going to talk more about that. Vanessa, but paint a picture of how volunteering was impacted by COVID. We were like quite a bit. You don't realize it. We love our volunteers coming here, and we rely a lot on them to care for our patients and fill some of those gaps. But tell us kind of what that looked like.
I don't recall a more unusual feeling in the early days of the pandemic when we had to make the decision to tell our volunteers that they cannot come to work.
Something you didn't ever expect to do.
Never would have expected that. So it was a difficult decision, and it just changed the way that everyone did everything. How staff then were doing tasks that our volunteers typically would do, and so we had to be creative as to how we were utilizing our volunteers remotely, and that was a challenge. We had never done that before, but we came up with ways that they could do some things and support our staff and our patients remotely, off-site, and then as we got further into vaccination clinics, then we had to call out to some of our volunteers to come and support with that. That was all before our volunteers were safely brought back.
Yeah, you would bring them back slowly but surely in those really needed areas, right?
Yes. So we got a little bit creative, but we made it work, and now we're fully open again. So that's been very.
And when we welcomed back our volunteers fully, that was like a celebratory moment to have their faces and have them, walking the halls here at the health system. But shocking for you to have to make those changes, but and certainly shocking for the volunteers to be told to stay away, something that they rely, something that fills their soul and takes their time, and that's how they give back to their community.
That's right. It really, for a lot of our volunteers, it filled their cup. It was their social interaction. It was it's that emotional paycheck, and when that was taken away, it really it was really felt, not only on the health system side, but on their
Dr. Nawalnik, I want to talk about how our habits are formed just in general and then changed when something completely unexpected, like a worldwide deadly pandemic, hits your life and your world.
Well, so behaviors get reinforced. And so when we think about something like volunteering, like Vanessa was talking about it being kind of their reward, like this gold that they have, for contributing and giving back. It's that reinforcement, that reward that makes the behavior more likely to be repeated. The more often that we repeat a behavior, then it starts to become habit over time. And that goes for good things, bad things, like the bad bag of chips that we want to dive into and just, maul the whole thing, because that instant gratification reward of the flavor, that's a habit that you can form. And, a lot of times when we talk about habits, there's a lot of, I should do this, I want to do that, I wish I did, I need to do that. And it's really the thing that we find most intrinsically and personally rewarding. That's what's going to stay on the table. That's what we're going to keep doing.
So those habits, the good habits, are just as strong and pull on you and tug on you, just like the bad ones? I hope so.
Exactly the same. Yeah, just like that. Yeah.
I mean, the bag of chips are good, but I got to talk to Brian and Jennifer, because I'm sure that their need to help out and be with others and do what you do best, which is to give of your time, was something that you missed. Tell me, Jennifer, I'll start with you. Just what was that like? Just tell us a little bit about the kind of volunteer you do, and then what was it like to say that you needed to stay put?
It was very difficult. I didn't think it would be that hard, but I really missed the interaction with the patients and just the employees, and it was isolating for us.
Isolating, that is a word we hear far too often when it came to this pandemic. Brian, have you always volunteered in some capacity, or was this a new habit for you?
No, I've volunteered most of my life, but in the past it's been more episodic. I help with a particular project or something. But yeah, at KU Med, I'm a pathfinder, so I help people find their way around the complex and deliver their mail. So I get to interact with a lot of folks. It's awesome.
Yeah, get your steps in and get that social interaction. I bet that was great. But to be told that you couldn't come here, how did you fill your time when you weren't here?
Walking, a lot of walking.
Brian?
And
yeah, I only started about a year ago, so I started after volunteers had resumed.
Well, that's good. Okay, so then Jennifer, you just said that you spent a lot of time outside and just trying to fill your time doing other things that are productive and good for you. What's that?
I said I walk by the facility because I live very close, and so I would walk by and just go, I want to go in so bad because I want to see what our patients are up to.
We were all out there just kind of walking around in circles, you know, breathing a lot of fresh air and sunshine, but still good choice.
Well, this whole Pathfinder thing, I got to say, when I first started working here, Brian, I could have used you. Like, I would wind up late to every meeting, lost. I mean, for those of you who have not been to the health system, it's a very large, expansive campus, and getting lost is easy. So Pathfinder, essential. And once I finally started to find my way, I would help patients find their way, because you just see that deer in headlights lost look that I used to have routinely.
Yeah, you can't walk by someone that has that look in their eye.
So I mean, it's to take that away just had to be devastating.
Well, and you just said that something as simple as that is essential. When you're trying to, I don't know how many people I've walked into looking around and trying to figure out where they're supposed to go, and that's a stressful time. They're out of their homes and trying to get to their appointments, and so that is definitely an essential thing. Truth be told, you said, we were just talking about this. I said, why don't you park closer? You said, if I parked anywhere where I park, I said, I'll get lost and I won't make it to the morning medical update. So it's,
you form these mental maps, and the more often that you use a certain area, it's really ingrained. If we start, and then there's certain areas that you have like a tangential familiarity.
Yeah.
And if you don't use that, it kind of, I'm not super young anymore. It just apparently that got discarded for some other.
You're really not.
Memory.
You're not the spring chicken that you claim to be. Now, but this goes back to our conversation about habits. We're very habit forming, and that's just the part of it. It's hard to let go of that.
Yeah. And the thing is, when we talk about something like the pandemic and how it disrupted habit, I spoke about the reinforcement of behavior and how that forms habits. Fear and avoidance of specific stressors is a way that we can immediately wind up altering our habits. And then the problem with that is, and I'm cautious in how I word this, and I'm probably going to mess it up, but the reality is that when we have something like the pandemic, our fear gets reinforced. And so we start to alter our habit and our routine in a way that leads us away from some of the things that we're rewarding. And then we maybe, like was mentioned, some of the isolation, that sense of isolation, that's a symptom of depression that in this case was, it was the right thing to do, but our brain doesn't know the difference. And when it notices that we're isolating, we're not engaging, it starts to fill in the blanks and say, you know what, something must be wrong. We must not be all right. And so then we start to actually have some depressive symptoms that can pop up. And so that's kind of this double-edged sword, and that's where we're at now when we're seeing, after the fact, we're still seeing the numbers of mental health impacts increase. So, we're out of it, but we're not out of it.
Well, and I hate to think of, that's why I love seeing Brian and Jennifer sitting here, because it's that thought that somebody who normally was out and about now turned being isolated into a new habit. So it's trying to figure out a way to get back to that old habit. I mentioned I want to talk about the top 3 reasons that we saw a drop in senior volunteers. We talk about that, Vanessa, and our guest had mentioned isolation. That's one of them, but I want to talk about fear. And you had mentioned that as well, Dr. Nawalnik, but fear to come back?
Yes.
Talk about that a bit.
Yes. So we have some volunteers who were with us prior to the pandemic that have not returned. And it wasn't necessarily because of health concerns. They were just fearful to come back into an environment where they could potentially in their mind they could potentially become ill. So we found that several of our very loyal long-term volunteers just were not coming back. And then I do think that we have seen a decrease in older volunteers, and I do think that perhaps those who would typically be apt to come and volunteer perhaps caught COVID early before we really had any treatments for that, and
we lost some of our seniors. We sadly
did.
Lost people.
So I think it was just kind of that perfect storm.
We were watching some video of some of our volunteers. It just goes to show these tasks and these things that people are doing. We talk about the burnout of our staff, and you think these are the folks that came in and like we talk about, kind of filled that gap.
That's right.
And then they are gone, and now our staff, who is dealing with a pandemic and caring for our patients, is now having to fill those gaps themselves. And it just, again, goes back to that perfect storm that you talked about. Dr. Nawalnik, tell us what maladaptive behavior is, when you normally use that term, and how does it relate to what we're talking about today?
Well, so maladaptive behavior is anything that doesn't help us, feel either more connected, feel healthier, essentially. And so that's typically used in terms of substance abuse, domestic violence, impulsive spending, sex acts, anything like that. So essentially maladaptive habits are things that we want to try to avoid, and including, like we talked about earlier, with overeating and things like that. So, sorry, what was the second half of the question?
I don't know.
Maladaptive, and then something
and why
else?
does it relate to what I'm teasing? What do we?
Well, okay, so what do we see now? So
yeah.
In terms of avoidance, and so when we start off and it's initially clinically advised to isolate and to avoid until we get more information or until a vaccine could be developed, that was an adaptive response. Maladaptive is when we know that there are ways to prevent this, we know that there are things that you can do, and we choose alternatives. Like, instead of getting a vaccine, we just say, you know what, I'm just going to keep staying at home. I don't need to go anywhere. My job is switched to remote, so I don't actually have to go. I can Instacart everything. My favorite plans before the pandemic were canceled plans anyway, so I'm out. And so that maladaptive piece, that's what we're kind of talking about here, in terms of because what this promotes is passive avoidance. And when we start to approach our life from the perspective of passive avoidance, it makes it ripe for the takeover of depression and or anxiety. Whereas active engagement is actually the key to kind of living an adaptive, fuller life.
So today is International Volunteer Day, by the way. You can scan the QR code there on your screen throughout our program to sign up or find out more information about our volunteer application process. Before we get to Dr. Hawkinson, just, Brian, tell us just what do you love the most about volunteering? Speak to those out there who maybe have thought about getting back to volunteering or want to try doing that and give up their time. What's your favorite thing? What's your message?
Well, I would emphasize that probably the greatest thing about it, some of these things are intrinsic in volunteering, about how it makes you feel and so forth. It reaffirms my faith in people. I meet a lot of people. They're in a very stressful moment for the most part. They're coming to the hospital. They're either sick or getting some sort of treatment. And to talk to them, to let them know there are other human beings that care, that's what I get out of it. I personally, what Dr. Nawalnik was saying, I personally learned the hospital when my wife was being treated for lymphoma. And, when she was sleeping, I would walk the hospital. So that's how I learned the place, and so fit in as a Pathfinder is pretty good fit. But the other thing that he said was, throughout our time with KU Med, every time we got off an elevator, and we were stressed out, obviously, and we're looking around like, whoa, where do we go? There was always a staff member and or volunteer that would say, hey, can I help you out? And it was therapeutic for us. And I appreciated that so much, I thought I need to get involved with it.
I love that story. A patient or patient's family having a good experience here or anywhere, and then turning around and kind of full circle moment, turning back into a volunteer and helping others the way they were helped. Jennifer, what is your big takeaway? A lot of times people say they get more out of volunteering than they even give. So,
that's so true. I always tell the patients they're so thankful for. I do a refreshment cart, and they're so thankful for a drink or a little snack or just a little chat. And I keep telling them, I said, we have the best patients and we get so much more back than what we ever give them. It just makes my heart warm. And when we came back after COVID, they would stop us in the hall and thank us for coming back and tell us how much they missed us. So it's very, very rewarding. It just makes me very happy.
They missed you and you missed them.
I did.
Let's turn to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, on this Monday morning with our COVID numbers creeping up a bit.
Yeah, creeping up a bit. You know, again, the overall national case numbers are not being reported as regularly as they used to be. Some outlets have gone to once a week. But we know the last couple weeks there was a slight bump compared to the previous few weeks. And we could be seeing the result of that now with our hospitalizations. As we know, hospitalizations lag cases by a couple weeks. So right now, unfortunately, 32 active cases in the hospital, 3 in the ICU, none on the ventilator, 23 in that recovery period. We did have our last inpatient death on December 1st as well. So overall, hopefully the numbers aren't going to push up too much more, but we know, and as we heard, you know, there's at least 3 major respiratory viruses going around: RSV, influenza, and SARS-CoV-2, but we also know there are those other common cough and cold viruses which are really circulating at high levels now too as well.
Yeah, a lot to dodge out there for sure. Doc Hawk, new research found stress from the COVID pandemic led to teenagers' brains physically aging faster. Can you explain more about that study and what it found?
Yeah, I mean, this is kind of similar to other studies we've seen where they've actually looked at brain imaging, particularly MRI, because it is so sensitive to pick up very, very small changes in the brain tissue and what the brain looks like. They were able to have MRIs prior to the pandemic from some of these children. It was a small study, so I think that is one of the caveats. But they were also then able to repeat those MRIs into sometime in the pandemic. And what they found was that there was signs of increased or accelerated aging of those brains in those adolescents. And this wasn't a good thing. It was more related to kind of changes they see in children with chronic stress, neglect, abuse, trauma, things like that. So we know that this pandemic has affected most everybody in different ways, but especially mentally and emotionally. And don't know if Dr. Nawalnik has any comment on that as well, but it is certainly, you know, real. We can see these changes physically in our children's brains.
He teed you up for that one.
Right? I was hoping he wouldn't, but he did. No, I mean, I haven't seen the study, but you know, obviously you can see the parallels between the pandemic response and trauma and neglect. I mean, it's it'd be foolish to think there wouldn't have been some impact.
Some link, yeah.
And I think we hear and see that from our pediatric colleagues. We hear it and see it from the people that probably deal with our children the most, those teachers, those school administrators, those counselors. I think they have seen it as well, and we've heard stories about that as well. So it is certainly a true entity out there, and continues to affect not only adults, but children as well.
Absolutely. No surprise to learn that.
Yeah.
I want to check and see if we have any reporters on the line today. All right, let's get to some community questions. And Angie has one. Vanessa, when were volunteers allowed to come back in full capacity? And how do we keep them safe? Remind people of that. And keep them safe and keep others safe from them.
Yes, so we always follow all of the pillars of infection prevention. All of our volunteers are fully trained on how to be safe while they're here, including hand hygiene, masking. We do not allow our volunteers to enter patient rooms. That's for their safety and the patient safety as well. Let me rephrase that. Patients who are in isolation rooms, COVID rooms, anything of that nature, that's for the safety of our volunteers and for our patients.
And they are vaccinated?
And they are, yes, and they are vaccinated, both flu and COVID. So
Thomas wants to know, how do you get approved to be a volunteer? You go through the application process. Again, we put that QR code up there that you can click on and find the link and get that application rolling. But what's the approval process like?
Yes, we make it very easy for anyone who is interested in coming to volunteer here. We have an application that is online, and we set up a time to have the volunteers come in, for potential volunteer to come in for an interview, learn about them a little bit and what areas of interest they might be looking at, and we try to find a match.
So that kind of leads me to another question that someone had, is what kind of run the gamut? We've got so we have Jennifer, who pushes around the treats and beverage carts, which that sounds like super fun. That's right up my alley. And then we have Brian, who helps people navigate this big, huge health system. And then we saw some of our other volunteers there doing different things clinically, and then over like at our retail shop. And so tell us some other areas that people might be able to dive into and help out.
So a very popular area to volunteer is in our NICU, holding NICU babies, our Rocket Babies. Our Rocket Baby program is very popular. I will just say that there's a wait list for that position, but it is very needed. I think our NICU team really missed our volunteers during our pause in volunteering, because that frees the nurses up to take care of the mom or other babies, and our volunteers are there to hold those babies that need that attention. Actually, right now, I love it that Brian was talking about his experience with pathfinding, because that is a position that we're really looking at adding to. So I think it was mentioned that there's stress and worry when people come in, and it's a big place. So that's an area that we're really looking at adding more volunteers to, but really we have volunteers both clinical and non-clinical areas.
Just what you said about that, though, is just seeing like a calm face smiling back at you, offering to help, versus you trying to figure out where to go and trying to find somebody with a badge on that might be able to help you around. So it's just nice to see a face like one of these two faces here to help you out. Lisa has a question for Dr. Nawalnik. While we're here, we've got to get our free mental health advice. She had never struggled with anxiety until the pandemic hit. Is this something she's always going to have moving forward, or can she reverse this?
Well, I mean, that's not an instant yes or no answer, but the reality is that anxiety is not always maladaptive. So, I mean, when we hear people say, I've never had anxiety before, everybody's had anxiety. It's part of life, and it serves a purpose. It exists to try to alert us to threats, to try to move us to action, to help us to meet deadlines, to help us to take care of the things that we're supposed to. So anxiety gets a really bad rap, and obviously once it crosses over to pathological, that's where it starts actually like impacting your overall sense of pleasure, your engagement in your life, your sense of joy. And so if that's what we're talking about, there's nothing that says that Lisa has to continue to experience this for the rest of her life. But anxiety is a self-feeding animal. What that means is it will lead you to look for more things to worry about. And it's a response cycle that isn't meant to happen all the time automatically. And so the problem here is that eventually people start to get worried about feeling worried. And so I think the first sense is just trying to normalize that, hey, this was a rough deal. There was a lot of triggering events or a lot of different things going on that should have sparked some anxiety and some worry and some concern. If we're not seeing that start to turn down now, things that I've always said on here is avoid social media. Avoid most media, in fact, because the reality is that, clickbait, it tries to keep us scared, tries to keep us mad, tries to keep us off balance. So what I encourage is just always get back to what can you actually control, you have to risk, take risk versus reward. So maybe, a family holiday dinner, maybe that's okay, but maybe the music festival is something that we're going to forego for a little bit. So it's just trying to figure out and find a balance. But recognizing that anxiety does serve a purpose, and the sooner that you can acknowledge that you're anxious, find what you're worried about, see if there's something you can do about it, and then move on, the better it's going to get. And if you're noticing that trying that and deep breathing, good diet, restful sleep, exercise, if those things aren't all helping, you've tried them, maybe it's time to reach out to a professional and just get a little nudge through this. That's all.
Get a little nudge. I like that. Ask questions, seek help. Brian, I saw you kind of shaking your head, like agreeing with Dr. Nawalnik when he was talking about anxiety, and we all have it and all of those factors. What can you add to that?
No, I love the advice because, yeah, I've dealt with a lot of anxiety over my 67 years on the planet. And I resonated a lot of the things the doctor was saying.
Yeah, it does. And you just learn to manage it through
Yes.
the peaks and valleys, right? It never really goes away. You just learn to manage it better, right?
Brian's my man. We're going to have to get a coffee if I see him around sometime.
That's what I'm saying. You two are going to cross paths.
Right?
For sure, for sure. Jennifer, anything you could add? We talked about this isolation and fear for folks who are at home, getting away from those habits and the things that they love. I mean, what kind of things are you willing to share that maybe you came across, some challenges for you?
As I said before, it was very isolating for us. You can only read so many books and do so much. And so it was just a difficult time. And we just knew that there was going to be an end to it. And so we were thrilled to come back. And it's made a world of difference in my life.
Love that. Vanessa, why are we seeing this younger population starting to be good up-and-comers in the volunteer world? That's good news.
It is good news, and I love it. I think part of it is schooling. Now that things we know that we can do things safely, and so the schools have requirements, for students to have volunteer service hours. But I think above that, these students who are looking to get into something in the medical field, they're really searching out avenues that they can get that experience. And of course, we love that. And so we've really seen an uptick in our volunteers in the younger age. Not only because it's required for school, but because they really want to be here. And additionally, we've had younger working professionals now that we have some more opportunities on the weekends, and in the evenings they can come. And so they say, I just want to give back to my community.
Well,
so
what a great, talk about a great habit to start early. I mean, we talk about bad habits we all acquire over a lifetime. What a great one to start. And certainly over the holidays when you're with your kids or they're coming back from college, what a great time to just talk about it, kind of, put the bug in the ear. That's right.
Well, and the other thing is that for both younger folks and retirees, volunteering is such an amazing opportunity to help kind of gain another aspect and a sense of your identity. It becomes something else that can define you. It gives you something to talk about at parties. It gives you something to feel a sense of self-esteem. It gives you a sense of you're contributing and you're meaningfully impacting something. And the youthful side as well as the older side are so desperately in need of something like that, because it really fills the void. Because for kids, it's like, school, there's so much pressure, social life, so much pressure. This is somewhere that it's not pressured. You come and it's immediately rewarding. It feels good. It's something that, and then you leave with your head a little higher. And in the retiree population, it's this sense of a loss of a career, and it's like, well, now what? And so finding something else that's meaningful, that's impactful, that you can do and engage in, it's so valuable. And so I think getting back to it and making sure we're taking the precautions that we can keep this going and sustain it is just so important.
And I think you just answered Jerry's question, because it says it's that time of year where there you got it. That's what you do. That's what you do. You know what we're thinking. So we talk about seasonal depression. He was asking, when that starts to sink in, what are some ways to get that mental boost? You just answered it. I mean, find those ways to get that instant sensation of feeling good in a moment that you feel good and you made somebody else feel good. Yeah.
I mean, it's such and volunteering somewhere like this, it's indoors. How do you beat that? In these conditions, is it starting to get really blustery and cold and noxious, and it's going to be that way for a hot minute? Yeah, get inside and do your thing. Give
back and stay off social media. Take a social media break. I think that could be some of your best advice that you give every time you're here.
I try.
That's good.
And I know it's ironic that we're on Facebook.
Just nothing to see here.
But this is good social media.
Exactly.
And there are good aspects of social media. Like I know that I kick it every time, but it's what I'm trying to kick is the manipulative aspects of it, the pieces that aren't what you're looking for, but that find you and that then twist and kind of keep pulling you back in. That's not what social media should be used for. And the more that you can do to take advantage and disrupt that and make it your own experience, the better.
Well said. All right, let's get to some final thoughts. Brian, I'll start with you. What are your final thoughts? What suggestions or messages do you have to our viewers today?
Well, I would start by saying that I think Jennifer and I have mentioned some of the merits of volunteering at KU. It is no pressure. That's a fact, and so in a way, there's no there's nothing negative that I've encountered. I've had a few nasty folks that I've dealt with, but they were generally nasty to each other and not to me. It's something that I would strongly encourage people to consider, and the things that Dr. Nawalnik was just stating about how it helps me with my mental health. It helps me. My wife can't wait for stories when I come home after my shift, because there's always something funny.
I love
So
that.
I would strongly suggest considering doing something like this.
Brian, thank you. Just thank you for being here, but thank you for helping our folks here at the health system and just being great out in our community and being a great example. Jennifer, your final thoughts.
Volunteering for me just brings me joy, and it also grounds me at the cancer center, that things that used to worry me don't anymore, because I just take every day as it comes and enjoy it.
That's a really good point. You know, you come here and you know, there's no one's really here unless you're up in that, you know, up on the mother baby, seeing a new baby come into the world. It's really hard to imagine somebody being here for a really great reason. There's sick people and there's stressed out families here. So to come to a place like this and walk away feeling just a load of gratitude is a good feeling. Vanessa, your final thoughts, and just what do you want people to know about the application process and getting more volunteers through our doors?
Yeah, well, gosh, I don't think I can say it any better than Brian and Jennifer, so thank you, because they are just amazing volunteers to have on our team. So they said it so well, I couldn't do any better. But regarding the application process, like I said, we like to make it nice and easy, and we would love to talk with anyone who has any interest in coming and being part of our team. We make it fun, and we really just want to make sure that we match you with what you're interested in. There's lots and lots of things to do here, so we would love to have you be part of our team.
Let's put that QR code back up if we can for folks who want to click on that and find out more about how to volunteer here and how to make it through that application process. Dr. Nawalnik, more words of wisdom. What do you got for us?
I mean, if you're looking for words of wisdom here, you're getting blood from a stone. But
Stop it.
The reality is that, you know, this is the holiday season, and people struggle to figure out how am I going to afford gifts? How am I going to pick the right gift? And I think that something that's been true for forever is that the greatest gift you can give is a gift of your time. And the gift that you can give in a setting like this to a stranger who's in need and might not even know that they're in need in that moment until you show up as that volunteer, that's a gift that you're giving them that they'll always remember, they'll treasure that. And you'll also get something from that too that you'll always remember and always treasure as well. And as I sat down at this seat, there's a little pen here, little dude, that's giving a thumbs up, and so I just want to give a thumbs up to volunteering. So
Let me see that. Where did that come from?
Jennifer and Brian, this thumbs up for you.
Yeah.
Where did that come from?
It was just sitting here. I didn't
want
do
that
it.
pen.
It's yours now.
Are you? Thank you. Let me
you
see
go.
that. Where is that from?
I think
Oh,
I
it's
saw it
one
in
of
the
our.
studio the other day.
No, it's a health system pen.
I know.
With a little guy with like.
With a thumbs up
with
and
thumbs
crazy
up and
hair.
fun
What could be
hair.
more?
I didn't know we give these out. Do you see these?
I
Everybody's
don't
going to want
think
to come
they
here
do.
for
I think
these.
Santa left it there.
I love that.
Or
Okay,
somebody's
this-
elf.
The elf on the shelf.
The elf
that.
left it there.
That
yeah.
is fantastic. Okay, my new little friend for the week. Okay, Doctor.
Thanks, everybody.
Doctor, and thank you for our great guest today, Dr. Hawkins. And final thoughts.
I don't think anybody can follow that pen.
I don't think so either, but try. You could try.
I'll try.
His hair kind of looks.
You know, I think
it's
we
the
always
hair
talk
here.
about the physical and medical, prevention and health. A lot of these stories that we have, and of course, whenever we have Dr. Nawalnik on, it's so important to remember that emotional and mental. And we just saw a headline as well about how the pandemic has affected even children's, adolescents' growth and development as well. And we just have to continue to understand that and keep ourselves not only physically healthy, but also look and strive for that mental and emotional health as well.
Very well
health
said.
as well.
Yes. All right, everyone, thank you so much for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Go out, make it a great Monday, and we'll see you back here Tuesday at 8. Coming up tomorrow on the Morning Medical Update. Every second, someone over the age of 65 in the U.S. falls. It's a statistic that includes increased injury and death, making it a growing public health concern. I'm Jessica Lovell. Tuesday on the Morning Medical Update. The top 3 common causes of falls and what you can do to avoid a takedown. See you at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.